My presentation will be on EMS and their response to the opioid epidemic. Over the years, the U.S. has seen a wave of drug addictions and opioid overdoses. According to spatial clustering of heroin-related overdose incidents, a case study in Cincinnati, Ohio by Choi, Lee, Ye, Lan, and Kang, drug overdose is one of the top leading causes of accidental death in the U.S., largely due to the opioid epidemic. Since 1999, more than 760,000 people have died from drug overdose, and the number of opioid-involved overdose deaths has increased over 6 times across the U.S. This image of a map of Cincinnati shows that the southwest part has significantly higher levels of heroin overdose incidence than northern regions. As we can see, the darker colors represent higher levels of overdose, whereas the lighter colors represent the lower levels. Although we see that the regions that struggle with this issue more than others, it is evident that opioid overdose is a growing epidemic that must be considered. So how does EMS fit into this picture, and how can we pull away from our corporate positions to do something about this serious issue? To start off exploring this topic, I would like to explain what prompted me to dig deep into research on EMS and their relationship with individuals struggling with opioid overdose. I was always intrigued by what EMS professionals do and the tactics they use to provide emergency care to their patients. One day, I was talking to my coworker who explained that she used to be an EMT. I could tell that she was passionate about helping people, but there was something that put her off in her profession. As she was telling me about her past duties, she told me that one of the biggest issues she saw in her profession was the issue of opioid overdose. She told me that she responded to many overdose scenes where they would help the individual and leave. That bothered her the most. They had to leave the children living in a dangerous home environment, and there was nothing they could do. She often responded to the same homes time and time again because the root of the issue was never resolved. The overdoses kept happening because care was given to stop the overdose, but not prevent it. Another moment that prompted me to look into this issue was when EMS began to respond to frequent overdose calls from my neighbor. EMS kept responding, but the issue was never resolved. I knew that the children in the home were not in the safest environment. I'm sure that EMS knew that the children weren't safe either. One day, their 14-year-old son got fed up with his life and took a gun to his head. When EMS responded to the incident, it was too late. So how can EMS professionals respond to an overdose scene faster? Is there a way to locate these cases before things get out of hand? Hidden and Groff explained that drug hotspots can be targeted through law enforcement data sets in their article titled Using Emergency Medical Services Call Data to Target Illicit Drug Use Hotspots. Hidden and Groff state, we find that both EMS calls and police incidents indicate illicit drug use is concentrated at a small number of street segments, yet their spatial pattern is different. Together, the two data sets sources identify new street segments as hot places of drug use, suggesting that law enforcement agencies should incorporate EMS data to more accurately locate drug hotspots. Hidden and Groff explained that police locate drug cases by targeting drug sellers, whereas EMS professionals examine public health issues. EMS and the police force put their data from their targeted police groups together in order to get a better reading of where drugs are being mishandled so they can intervene. Good Samaritan laws have been enacted to protect civilians when they try to resuscitate an unconscious individual. The civilian is desperately trying to save their life, but sometimes when the person wakes up, they get angry. They're confused and angry that someone just broke their ribs or unintentional harm came to them. Before Good Samaritan laws were enacted, there was the possibility that someone could sue a bystander for not performing CPR accurately or without consent. These laws protect these bystanders that tried to save someone's life. However, did you know that Good Samaritan laws were put in place to help individuals that are struggling with addiction or an overdose? Over the years, people have become wary of asking for help with their opioid addictions because they have had bad encounters with police and first responders. Molif, Choi, Malloy, DeBeck, Kerr, and Hashi state in their journal article titled A Drug-Related Good Samaritan Law and Calling Emergency Medical Services for Drug Overdoses in a Canadian Setting. Of concern, people who use drugs, PWUD, are known to have fear about EMS calling, as calling an emergency number 911 in Canada and the USA can attract police to the scene. Previous studies have reported possible repercussions associated with calling EMS among PWUD, including arrest and harassment by the police, and a subsequent loss of publicly funded housing or custody of children. Once the Good Samaritan laws were enacted, people felt much more comfortable calling for help. A stronger relationship can now be established over time because individuals can finally feel safe and feel like they can get the help they need. The article goes on to say that in the case of an opioid overdose, naloxone is a drug that is often administered. People who use drugs can often feel relief from the effects of naloxone. Pause this video to scan the QR code to learn more about naloxone through this interactive quiz. Now that we have an idea of how EMS tracks overdose cases and how they reverse the effects of an opioid, let's go back to the situation of my neighbor that was discussed at the beginning of this presentation. Remember that my neighbor often struggled with opioid overdoses. They desperately needed help. They struggled through a helpless cycle of regression. However, the children in their home also struggled with a helpless lifestyle. So how does EMS work to stop this problem? Can they do something to remove children from an unsafe home? What have they done to stop this problem? An article by EMS World titled Child Abuse and Neglect, Mandatory Reporting for EMS Providers states, many states struggle with underreporting. Many EMS providers have been told in primary EMS education or by agency supervisors to report to the hospital, and that counts as mandatory reporting. The article goes on to say that it's often hard to determine whether a child was safe or not. A lot of data needs to be taken, and they often don't want to unnecessarily take a child from a home that is not being harmed. They state, despite common belief, it is not enough to just pass on your findings to the emergency room nurse or physician upon patient drop-off. It is also the responsibility of the EMS provider to contact child welfare and/or law enforcement, as well as fill out and submit the proper paperwork for reporting. They also explain that often EMS professionals feel as if child welfare and law enforcement agencies don't do anything with the information they find. The case then stops there, or does it? EMS professionals have taken the initiative to instill programs to provide treatment and prevention for opioid overdoses. An article titled Emergency Medical Services Targeting Opioid User Disorder, an exploration of current out-of-the-hospital post-overdose intervention, explains that there is a program by EMS called Project Outreach that increases treatment initiation among overdose survivors. A program called New Orleans EMS uses data to track, monitor, and focus efforts of opioid overdose. Another program called Drug Overdose Prevention and Education Project, put on by EMS professionals in California, detects market changes in illicit drugs and expands naloxone access. These are just a few of the initiatives that EMS professionals are engaging in across the country. So now this is where you come in. You are at the top of the corporate ladder doing amazing things for the company. However, life gets mundane. You want to help in a greater way. Maybe you don't have time or you don't know how to get involved in public service to your community. There are actually many things you can do behind the scenes to lower the rates of opioid overdose. For example, someone comes into your office wanting a job. He takes the drug test and fails. Do you send him away or do you give him information that could help him? Maybe send him information on local treatment programs and a lower level job that he could apply for until he gets his life on track. Maybe down the road he will overcome his addiction and could reapply at your office. Maybe you need to be more aware of your surroundings to catch people or children that need help. You can even call local drug prevention programs in your area or talk to an EMS professional to see other ways you can get involved. Opioid overdose is more than a crisis. It's an epidemic. However, we can work together to reduce this issue and bring hope and healing to those around us. Thank you.